Hi and welcome viewers of Nursing Academy 101. In this video we will talk about the challenging NCLEX-RN and Prometric questions related to epidemiology, along with the answers and rationales part 1. But before we start, please, do not forget to subscribe, like and share the channel to encourage us to continue and provide you with all new. Question 1. A nurse is caring for a group of patients in a hospital setting. Which patient would be considered at highest risk for contracting a healthcare-associated infection? A 30-year-old patient with a broken leg. B. A 40-year-old patient with controlled diabetes. C. A 60-year-old patient with chronic obstructive pulmonary disease, COPD. D. An 80-year-old patient undergoing chemotherapy for cancer. Answer. D. An 80-year-old patient undergoing chemotherapy for cancer. Rationale. Patients undergoing chemotherapy have compromised immune systems, making them more susceptible to infections. Healthcare-associated infections, HAIs, can be particularly dangerous for such patients due to their weakened ability to fight off infections. Question 2. The nurse is conducting an epidemiological study on a recent outbreak of foodborne illness in a community. Which measure would be most appropriate for the nurse to calculate in this situation? A. Prevalence rate. B. Incidence rate. C. Case fatality rate. D. Attack rate. Answer. D. Attack rate. Rationale. The attack rate is used in epidemiology to calculate the proportion of individuals who develop a specific illness, in this case, foodborne illness, among those exposed to a particular risk factor, such as consuming contaminated food, during an outbreak. Question 3. A nurse is reviewing data related to the occurrence of a disease in a specific population. The nurse notices that the mortality rate of the disease has significantly decreased over the past decade. Which of the following conclusions can the nurse draw from this observation? A. The incidence of the disease has increased. B. The prevalence of the disease has decreased. C. The case fatality rate of the disease has increased. D. The case fatality rate of the disease has decreased. Answer. D. The case fatality rate of the disease has decreased. Rationale. The case fatality rate refers to the proportion of deaths among individuals diagnosed with a specific disease. A decrease in the mortality rate indicates that fewer people are dying from the disease, suggesting improved medical care and treatment outcomes. Question 4. A nurse is conducting a study on risk factors for cardiovascular diseases, CVD, in a community. Which of the following is an example of a modifiable risk factor for CVD? A. Family history of CVD. B. Age above 60 years. C. Gender, male. D. Sedentary lifestyle. Answer. D. Sedentary lifestyle. Rationale. A modifiable risk factor is a risk factor that can be altered or controlled to reduce the risk of a disease. In this case, a sedentary lifestyle is a modifiable risk factor for cardiovascular diseases. It means that individuals can reduce their risk of CVD by incorporating regular physical activity into their daily routine. Question 5. The nurse is involved in a disease outbreak investigation in a community. What is the primary purpose of conducting this investigation? A. Identifying individuals responsible for the outbreak. B. Allocating financial resources to control the outbreak. C. Implementing measures to prevent future outbreaks. D. Developing new treatment options for the disease. Answer. C. Implementing measures to prevent future outbreaks. Rationale. The primary purpose of a disease outbreak investigation is to identify the source of the outbreak, understand the mode of transmission, and implement appropriate measures to control and prevent future outbreaks. It aims to protect the health of the community and prevent the spread of the disease to other individuals. Question 6. The nurse is conducting an epidemiological study on an infectious disease outbreak in a community. Which of the following is the most appropriate method for determining the source of the outbreak? A. Case control study. B. Cross-sectional study. C. Cohort study. D. Randomized controlled trial. Answer: A. Case control study. Rationale: a case control study is the most appropriate method for determining the source of an outbreak. In this type of study, the researcher compares individuals who have the disease, cases, with individuals who do not have the disease, controls, and then looks for specific exposures or risk factors that may be associated with the disease. It is particularly useful in investigating outbreaks because it allows researchers to identify potential sources or risk factors related to the illness. Question 7. The nurse is reviewing data on the prevalence of a chronic disease in a given population. Which of the following factors is most likely to influence the prevalence rate? A. Birth rate in the population. B. Migration of people into the population. C. Mortality rate in the population. D. Incidence rate of the disease. Answer: D. Incidence rate of the disease. Rationale: the prevalence rate of a disease is influenced by both the incidence rate, the number of new cases of the disease in a given time period, and the duration of the disease within the population. If the incidence rate is high, the prevalence rate is likely to be high as well, as there are more new cases contributing to the overall number of cases. Question 8. A nurse is conducting a community assessment to identify potential risk factors for a particular health condition. Which of the following data sources would provide the most reliable information on the incidence of the condition in the community? A. Hospital discharge records. B. Census data. C. National health surveys. D. Mortality reports. Answer: A. Hospital discharge records. Rationale: hospital discharge records provide reliable information on the incidence of a health condition within a community. They include data on the number of patients diagnosed with the condition and treated in healthcare facilities, allowing the nurse to track the occurrence of the condition over time and identify potential risk factors. Question 9. The nurse is reviewing the results of a study on the efficacy of a new vaccine in preventing a certain infectious disease. The study population was divided into two groups, a vaccinated group and an unvaccinated group. After a specific period of time, the number of cases of the disease was compared between the two groups. Which type of study is this? A. Cross-sectional study. B. Cohort study. C. Case control study. D. Randomized controlled trial. Answer: D. Randomized controlled trial. Rationale: in a randomized controlled trial, RCT, the study population is divided into two or more groups, and individuals are randomly assigned to each group. In this scenario, the vaccinated and unvaccinated groups represent the intervention and control groups, respectively. The incidence of the disease is then compared between the groups after a specific period to evaluate the efficacy of the vaccine. Question 10. A nurse is investigating a cluster of infections in a hospital unit. Which of the following terms describes this type of investigation? A. Pandemic investigation. B. Outbreak investigation. C. Surveillance investigation. D. Endemic investigation. Answer: B. Outbreak investigation. Rationale: an outbreak investigation is conducted when there is a sudden increase in the number of cases of a specific disease or infection in a defined geographic area or population. In this scenario, the nurse is investigating a cluster of infections in a hospital unit, which falls under the category of an outbreak investigation. The goal is to identify the source, risk factors, and appropriate measures to control and prevent further spread of the infections within the unit. Question 11. A nurse is providing education to a community about the importance of vaccination to prevent the spread of infectious diseases. Which concept of epidemiology is the nurse promoting? A. Herd immunity. B. Incubation period. C. Endemic transmission. D. Relative risk. Answer. A. Herd immunity. Rationale. Herd immunity, also known as community immunity, is the concept that when a significant proportion of a population is vaccinated against a contagious disease, it provides indirect protection to those who are not immune or cannot be vaccinated. This reduces the likelihood of the disease spreading within the community, protecting vulnerable individuals. Question 12. A nurse is analyzing data from a study on the relationship between smoking and lung cancer. The study found that individuals who smoked 20 or more cigarettes per day had a significantly higher risk of developing lung cancer compared to non-smokers. Which measure of association is the nurse likely to calculate based on this data? A. Odds ratio. B. Incidence rate ratio. C. Prevalence ratio. D. Relative risk. Answer. D. Relative risk. Rationale. Relative risk, RR, is used to determine the risk of an outcome, in this case, lung cancer, in an exposed group, smokers, compared to a non-exposed group, non-smokers. It quantifies the association between exposure and outcome in prospective or cohort studies. Question 13. A nurse is conducting a study to assess the impact of a new health intervention on reducing the incidence of a specific disease in a community. The nurse collects data on the number of new cases of the disease before and after the intervention. Which study design is the nurse implementing? A. Case control study. B. Cross-sectional study. C. Randomized controlled trial. D. Pre-experimental study. Answer. D. Pre-experimental study. Rationale. A pre-experimental study design involves collecting data before and after an intervention is implemented. However, it lacks the randomization and control features of a true experimental design. In this scenario, the nurse is conducting a pre-experimental study to assess the impact of the health intervention on disease incidence. Question 14. A nurse is investigating a suspected foodborne illness outbreak in a community. Which government agency should the nurse report the outbreak to? A. Centers for Disease Control and Prevention, CDC. B. World Health Organization, WHO. C. U.S. Food and Drug Administration, FDA. D. National Institutes of Health, NIH. Answer. A. Centers for Disease Control and Prevention, CDC. Rationale. The Centers for Disease Control and Prevention, CDC, is the primary U.S. federal agency responsible for monitoring and investigating disease outbreaks, including foodborne illness outbreaks. It plays a crucial role in preventing and controlling the spread of infectious diseases. Question 15. A nurse is examining the demographic characteristics of individuals diagnosed with a specific disease in a community. Which epidemiological concept is the nurse analyzing? A. Mode of transmission. B. Attack rate. C. Incidence rate. D. Descriptive epidemiology. Answer. D. Descriptive epidemiology. Rationale. Descriptive epidemiology involves analyzing data related to the demographic characteristics, example age, gender, ethnicity, of individuals affected by a disease to understand patterns and potential risk factors associated with the disease. It is an essential step in identifying disease patterns and trends within a population. Question 16. A nurse is working in a community health center and is conducting a study to identify risk factors for a specific disease. The nurse gathers data from individuals with the disease and individuals without the disease to compare exposure rates. Which study design is the nurse using? A. Cohort study. B. Case control study. C. Cross-sectional study. D. Randomized controlled trial. Answer. B. Case control study. Rationale. In a case control study, researchers compare individuals who have a particular disease, cases, with individuals who do not have the disease, controls. And then look for specific exposures or risk factors that may be associated with the disease. This design is appropriate for investigating rare diseases or diseases with long latency periods. Question 17. A nurse is reviewing a research paper that examines the distribution and determinants of a disease within a defined population. Which type of epidemiological study is most likely described in this research paper? A. Ecological study. B. Cohort study. C. Cross-sectional study. D. Experimental study. Answer. A. Ecological study. Rationale. An ecological study is a type of epidemiological study that examines the distribution and determinants of a disease within a defined population at the group or population level. It looks at associations between exposure and outcomes but does not involve individual-level data. Question 18. A nurse is conducting an outbreak investigation in a community. What is the primary purpose of an outbreak investigation? A. To determine the specific cause of the outbreak. B. To allocate financial resources to control the outbreak. C. To implement measures to prevent future outbreaks. D. To identify individuals responsible for the outbreak. Answer. C. To implement measures to prevent future outbreaks. Rationale. The primary purpose of an outbreak investigation is to identify the source of the outbreak, understand the mode of transmission, and implement appropriate measures to control and prevent future outbreaks. The focus is on protecting the health of the community and preventing further spread of the disease. Question 19. A nurse is reviewing a community's health data and notes a significantly increased incidence of a specific infectious disease. Which measure is the nurse likely to use to compare this increase in incidence with previous year's data? A. Odds ratio. B. Attack rate. C. Relative risk. D. Standardized mortality rate. Answer. C. Relative risk. Rationale. Relative risk, RR, is used to compare the risk of an outcome, in this case, the incidence of the infectious disease, between two different groups or time periods. By comparing the incidence rate in the current year with previous years, the nurse can determine the relative risk of the disease and assess the increase in risk. Question 20. A nurse is participating in an epidemiological study on a new outbreak of an infectious disease. Which public health measure should the nurse advocate to prevent further spread of the disease? A. Mass vaccination of the affected population. B. Closing all healthcare facilities in the region. C. Disseminating health education materials. D. Isolating all affected individuals in quarantine centers. Answer. A. Mass vaccination of the affected population. Rationale. Mass vaccination is a crucial public health measure to prevent the spread of infectious diseases in an outbreak situation. It can help establish herd immunity, reduce the number of susceptible individuals, and limit the transmission of the disease in the community. By vaccinating the affected population, the nurse can mitigate the impact of the outbreak and prevent further cases. Question 21. A nurse is conducting a study to investigate an outbreak of a foodborne illness in a community. Which of the following is the most appropriate measure for the nurse to calculate to assess the strength of the association between exposure to a specific food item and the development of the illness? A. Relative risk. B. Odds ratio. C. Incidence rate. D. Attack rate. Answer. B. Odds ratio. Rationale. The odds ratio is the most appropriate measure to assess the strength of the association between exposure and the development of a disease or illness in a case control study, such as investigating a foodborne illness outbreak. It compares the odds of exposure among cases, individuals with the illness, to the odds of exposure among controls, individuals without the illness, and quantifies the strength of the association. Question 22. A nurse is conducting a survey to assess the prevalence of hypertension in a community. Which of the following best describes the prevalence rate of hypertension? A. The number of new cases of hypertension during a specific time period. B. The proportion of individuals with hypertension among the total population at a given time. C. The proportion of individuals without hypertension among those at risk for the condition. D. The number of deaths due to hypertension within a specific population. Answer. B. The proportion of individuals with hypertension among the total population at a given time. Rationale. The prevalence rate represents the proportion of individuals with a specific condition, hypertension in this case, among the total population at a given point in time. It provides information about the burden of the disease within the community. Question 23. A nurse is conducting an epidemiological study on a particular infectious disease. Which of the following measures should the nurse use to assess how rapidly the disease is spreading within the community? A. Prevalence rate. B. Attack rate. C. Incubation period. D. Incidence rate. Answer. D. Incidence rate. Rationale. The incidence rate measures the rate of new cases of a disease within a specific population during a defined time period. It indicates how rapidly the disease is spreading and provides information about the risk of acquiring the disease within the community. Question 24. A nurse is reviewing data related to a disease outbreak in a community. The data shows that the majority of cases occurred within a short period, and there was a rapid decrease in new cases afterward. Which type of epidemic curve is most likely represented by this data? A. Common source epidemic curve. B. Propagated epidemic curve. C. Point source epidemic curve. D. Mixed epidemic curve. Answer. A. Common source epidemic curve. Rationale. A common source epidemic curve shows a rapid increase in cases followed by a rapid decrease and indicates that the outbreak is linked to a single common source of exposure, such as contaminated food or water. The majority of cases occur within a short time frame and then decline once the source of exposure is identified and controlled. Question 25. A nurse is investigating an outbreak of a vaccine-preventable disease in a community with low vaccination rates. Which concept does the nurse need to understand to address this situation effectively? A. Incubation period. B. Endemic transmission. C. Herd immunity. D. Relative risk. Answer. Herd immunity. Rationale. Herd immunity refers to the indirect protection from infectious diseases that occurs when a significant portion of the population becomes immune, either through vaccination or previous infection. In a community with high vaccination rates, herd immunity prevents the spread of the disease and protects vulnerable individuals who cannot be vaccinated. However, in a community with low vaccination rates, the lack of herd immunity can lead to outbreaks of vaccine-preventable diseases. The nurse needs to understand this concept to emphasize the importance of vaccination in preventing disease transmission and protecting the community as a whole.